My name is Dr. Dimitri. I'm a fellowship-trained, board-certified facial plastic surgeon with offices in Beverly Hills, California and Tampa, Florida. I'm super excited to be back here in Dallas, Texas as the Chief Medical Officer for Vitalyc Medspa. Our #1 mission here is to help you defy aging and restore your confidence. We are equipped with the latest and greatest in the aesthetic industry. Today, I'm going to be doing a demonstration of Morpheus8 on our beautiful patient, Jenna. Morpheus8, you can see the platform here, is radio frequency microneedling. This is an excellent non-invasive treatment that helps promote new collagen and elastin formation. That helps tighten your skin, it helps improve acne scars, the texture of your skin, and even fine lines. It's truly a great treatment and really applicable for just about everyone. So we've already topically numbed our patient here. She sat and had a numbing cream on her face for about 30 minutes. We're going to start with the application here. It's again, a great treatment. It's non-invasive. There's usually just about a day of redness after the procedure. Sometimes it can linger for a couple days. And she'll start to see results at about a week. And then we always recommend to our patients to do a series of 3 treatments. And just like traditional microneedling, you space it out about 3 to 4 weeks. So here we are, we're going to get started on her treatment. So you can hear that. That was a great application of the handpiece. The sound told me that all 24 needles came out at the same depth. It triggered a little bit of erythema, which means redness in her skin. That's great. That's a positive response. We're going to treat her entire face, neck, and forehead, and then I'll progress to the left side. So stay tuned. So I like to start, I'm left-handed. I start on the patient's right side usually. It's important when we're doing a treatment that the surface is flat and it goes right into the face. So you could hear that. That was a perfect penetration of the needles into the skin. Good application, and you can see she tolerated it nicely. How are you feeling? Good. It's important when you do the treatment that you lift up and then reapply the device. Our patients usually develop a little bit of erythema, which means redness, while we're doing the application. That's like traditional microneedling as well. That's perfectly expected and normal for the treatments. She will have the redness. It usually lasts for about a day or so after the treatments. We tell our patients not to apply anything to the face for about 6 hours afterwards, and then we give some moisturizers that they can apply. She'll start to notice results about a week after the treatment, and we always encourage patients to have a series of 3 for best results. It really works well at promoting new collagen and elastin formation, and that's what's going to tighten her skin. See, I just gently press down with the device, and I move from one treatment zone to the next. How you doing? See, it's very tolerable. See, we had a little twitch there with her muscle activity. We want the patients to be comfortable while we do the procedure. Again, I'm just doing topical anesthesia, so she had a numbing cream on for 30 minutes prior to our treatment. I treat the whole face. Usually I'll do the right side and then I'll progress to the left side. InMode, again, is a great company that we love to work with, and they offer a lot of other exciting technologies. She'll wait turn towards me, about 3 to 4 weeks before we do her second treatment. Okay. All right. So now I'm going to go a little bit lower on her depth. So you can see here, this is how I alternate my energies and my depths. We want to be very safe when we're doing the application, and there we go. Super easy to change up. So now I'm going to work on her neck a little bit. Great. You okay? And a lot of times So Jenna clearly has beautiful skin and a very strong jawline. She did mention to me prior she was concerned just about a little bit of fullness in her submental or chin area. So we're going to target that with the procedure. We can adjust the depth so it goes a little bit deeper into the subcutaneous fat, which is the layer right underneath the dermis. Again, she's a perfect candidate for this procedure, as is just about anyone. It really works well for skin tightening and for improving texture. That's where I've really seen the best result with my patients in that. Okay. Morpheus8 is truly the latest and greatest and non-invasive technology on the market right now. I think this is one of the premier treatments for skin resurfacing. Another area that's really troublesome for patients are the smoker lines, which are kind of lines around the lips. Now, Jenna actually doesn't have them, but a lot of patients will come in and they'll be like, "Doc, what can you do to fix these lines?" Well, the radiofrequency microneedling is great for that, again, because it's really working into the layer where we need to tighten the skin and promote new collagen and elastin formation. I've seen other providers try Botox and filler there, and I don't think it works as well as a treatment like this. Okay, now I'm going to try her forehead. So again, I want to be safe, so I'm going to go down on my depth and energy. And she was numb there as well. So tell me how this feels. How's that? Good. So I just progress from one area to the next, making sure I'm firmly applying the handpiece. And you can see already lower down here, she's developed the erythema or the redness. That's great. That shows that she's having a successful treatment and a good response. Turn her head. A lot of times what I'll do as well is after I've gone over a certain area at one depth, I'll come back at it at a more superficial depth, meaning I'm a little bit closer to the skin. This really helps trigger more collagen and elastin formation in different layers of the dermis. There are other troublesome areas in the body, such as right above the knees. A lot of times patients get their skin becomes elastic there and it's stretched out. Morpheus is a good treatment for that area, as well as the abdomen, and again on the neck too. Great. Excellent. So I've basically treated half of the face already. We're going to take a break and then move on to the left side of her face. Thank you. Or again, redness to her face. We treated her forehead, her face, and her neck. It took just about 15 or 20 minutes to do the treatment, and she tolerated it very nicely. Now we're going to focus on another area that's very exciting as far as a non-invasive treatment goes, her abdomen. So you can see here, of course, she's very smooth and flat, but she's had one son, right? And so there's a little area around her belly button or her umbilicus that she wants to treat. The Morpheus, again, is radiofrequency microneedling. So it works great at penetrating into the dermis and the subcutaneous fat. That's the layer that I really want to target with the Morpheus8. And again, the nice thing is that we can adjust the depth and the energy at which we're applying the handpiece. In the abdomen area, we have a little bit more fat there, so I'm going to go a little bit deeper, a little bit higher on the energy. You can see here we've applied a topical numbing cream. We're going to give her at least 30 minutes, 40 minutes or so to let this sit, numb, and so then when we start the treatment, she should tolerate it just nicely. Again, she'll develop some redness in this area after the treatment. That lasts maybe a day or two tops, and then it goes away. We tell patients to come back for a series of 3 treatments, and that will give you your best results. This is probably one of the best treatments and latest and greatest in non-invasive technology, and it really works well at tightening the skin in this area. So stay tuned and watch this treatment. Okay, so she's topically numb now for over 30 minutes. We've cleansed her abdomen, and we're going to get going with the treatment. Again, it's important when I apply the handpiece that I'm going to kind of pinch the treatment area and lift up a little bit, and the 24 needles here are going to go into the skin and really promote new collagen and elastin formation. So here we go. How was that? Okay. So you can see the patients tolerate it very nicely. And I just like to go in a grid pattern. Once I'm done with the treatment zone, I just move to the next one. You want to lift up and then reapply the handpiece. This is really great at tightening skin in troublesome areas like here around the belly button or umbilicus. We also use it above the knees. Sometimes we develop elasticity in our skin there, and it's a good treatment for that area. So our beautiful patient Jenna here is a mother of 1. It's a great treatment for females postpartum. We want to give them time to recover after the delivery, of course, but this area is really tough to get it go away with exercise and dieting. So this is a great treatment. Again, we recommend a series of 3 treatments. So we're doing 1 today. She's going to come back in about 3 to 4 weeks for a second treatment, and then again 3 to 4 weeks we'll do her final treatment. Just lift up and apply. The area of redness usually lingers for maybe a day or 2, and then it subsides. Again, this is done just obviously in our spa under local topical anesthesia. There's no need for general anesthesia or anything like that. This is a non-invasive treatment and perfect for a lunchtime break even. I have a lot of male patients who love this treatment as well. The lower abdomen is really tough to target, like I said, with exercise and even dieting. And so this is really a nice fix to target this area. She's having a great, you can tell, response to the treatment. It's turning red, and she has a little bit of wheeling from the needles. That's totally expected and normal. Yeah. And just to give you a reference as far as the erythema or redness goes, we can take a look at her face. We treated her about an hour ago. She's still slightly red, and you can see where we treated her across her face here, her forehead, and her neck. That is already going down a little bit. It's nice that the downtime is really only a day or 2 with this treatment. So patients can have it done, on a Wednesday, and they'll be ready for the weekend. I'm going to keep going here and finish her abdomen. How does this feel? Great. All right, we're all done.